Beauty scientists Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
So with Brazilian butt lift, the procedure is we essentially remove fat as fat harvest with liposuction. We process and filter the fat and we place it back into the buttock, because then we can actually reshape your body, reshape your buttock, and actually help with buttock sag. But it is controversial. So why is it so controversial, Dr. Hamilton, and how do you reduce the controversy?
So we've come up with a solution for this. So Brazilian butt lift or fat transfer to the buttock, it hit the news. There was an article that came out that said it had the highest death rate in all of plastic surgery. And what that was coming from was we're injecting fat back into you that we've removed after liposuction. And there's really large veins in the buttock, particularly in and underneath the muscle. And what was happening is those veins were getting damaged and then basically acting like a little vacuum, sucking the large globules of fat into your blood circulation, which was then going to the heart and lungs. And that's not a good thing because it would clog those organs. So what we found though, is if you inject into the subcutaneous plane, meaning into the fat, not the muscle itself, it actually becomes a very, very safe procedure. So how you know that's again controversial. Should you be using ultrasound to take a look at it versus just knowing your anatomic landmarks and staying away from it? We'll leave that's still being debated to this day in our societies. But we find if you do that, then all of a sudden the risk drops substantially. So the reason plastic surgeons initially were injecting the fat into the muscles got so much blood supply. So it's like full of blood vessels. And so that is amazing for getting survival of the fat and ideal for survival of the fat. Also, you're augmenting the gluteal muscle itself, which gives a very, very natural shape to the BBL. But we've all stopped doing that because we recognize the risk. And number one concern always is ensuring very safe result. I perform this procedure. I've never had any issues like that. And knock on wood, I never will, because I always stay in the safe plane and I avoid injecting into the area where we know those large blood vessels are.
Yes, totally agree with you. Know all about the debate. And it's a little odd as a plastic surgeon, only because you're right. They originally injected the muscle because there's great blood flow. We thought that the fat would last longer. Not true in the buttock. It's weird. It's actually true in other parts of the body. So there are definitely people who are injecting the pectoralis muscle, the shoulder muscles, things like that. They're actually injecting into the muscle as opposed to above the muscle. But in the buttock, you got to inject it not in the muscle, above the muscle. So
yes,
that's great.
And it's been a fun element of body contouring for other areas. I guess the blood vessels and veins are just not as large, so we can safely inject the pec, but or like the deltoids or biceps. So we'll do that for men having liposuction and fat transfer it's amazing, and it almost seems like the fat then like fuels their gym workouts afterwards. But for the buttock, we stay away.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.